Would you believe it if I told you that vaccinations were discovered by a farmer over 2 centuries ago? It isn't so far-fetched when you think about it. It just took a farmer and his family to be innovative risk takers. My name is Megan Curtis, and I have recently done research regarding vaccinations. From the flu to smallpox, diseases caused by viruses and bacteria are one of mankind's greatest afflictions. For the next few minutes, I will discuss the history of vaccinations, active versus passive immunity, and live versus inactive forms of vaccinations. First, I will discuss the history of vaccinations. Vaccinations were first discovered by an English farmer named Benjamin Jetsy. He was one of the first people to intentionally infect patients with a disease. In 1774, Jetsy inoculated his wife and children with fluid from cowpox. Cowpox is a disease carried on teats of milking cows, infamously known as smallpox, that was the cause of many outbreaks and deaths during this time. Because of Jetsy's innovative thinking, inoculation of disease created local community outcry. The locals feared that if they were inoculated with fluid from a cow, that they would actually take on cow-like characteristics. Because of the mass hysteria, the locals rejected the cowpox inoculation, which was later proven to be effective when Jetsy's family did not fall victim to the smallpox outbreaks in the following years. Jetsy was proven to be the first person to use vaccination, but was not credited for his discovery until later years. English physician Edward Jenner was the first person to be credited for discovering vaccinations. Jenner coined the term vaccination, which means cow, and was credited for discovering the first documented vaccination when he inoculated a patient with the cowpox virus in 1796. French chemist and microbiologist Louis Pasteur created the first live attenuated bacterial vaccine in 1870 and created the first live attenuated vaccine in 1885 that was introduced to humans. Louis Pasteur developed the first successful testing for rabies in 1885, which led to several more testing discoveries that we use today. By the 1920s, a broad spectrum of vaccines were available for common diseases such as diphtheria, pertussis, also known as whooping cough, and tuberculosis. Routine children vaccinations were readily available in the Western world, such as tetanus, polio, mumps, and many others. The discoveries of Jenner, Jetsy, and Pasteur paved the way to how we create, use, and administer vaccinations today. Because vaccines work with immunity, next I would like to talk about the basic function of the immune system and the two types of immunity. Immunity is the ability of the human body to tolerate the presence of material indigenous to the body identified as self, and to eliminate foreign non-self material. How does our body know the difference between self and non-self? The primary purpose of the immune system is to identify foreign non-self invaders called antigens. When an antigen is detected by the immune system calls in the immunity army to seek out and destroy the foreign invader. Our immune system will remember the foreign invader, so it will be well prepared to attack the foreign invader next time it enters the body. There are two types of immunity, both which play the most important role in vaccinations. The first type of immunity is passive immunity, also called humoral immunity. This type of immunity works in two ways. The first is immunity that is passed from mother to child through breast milk at birth that provides the newborn with mom's antibodies to help boost immunity. Another type of passive immunity is antibodies that are passed from one individual to another by injection. Passive immunity is very effective but short-lived. The second type of immunity is active immunity. Active immunity provides protection that is produced by the person's own immune system. When vaccines are administered, the immunity army attacks it, remembers it, and knows how to fight off the invader next time it attacks. Active immunity is effective and long-lasting. Finally, I would like to discuss the difference between live and inactive vaccinations. Live and inactive vaccinations work hand in hand with our immunity. Live attenuated vaccinations are weakened forms of viruses and bacteria. Live vaccines must replicate in the vaccinated person to be effective. Because of this, vaccinations can result in severe or fatal reactions due to uncontrolled replication of the vaccine virus. However, this reaction only occurs in people with immunodeficiencies such as HIV and cancer. This happens in people who are immunodeficient because they have such a weakened immune system, they are not able to fight off the virus or bacterium like a healthy person's immunity would successfully do. Active immunity has the starring role with live vaccinations. It actively produces protective immunity with the first dose, providing long-term protection against many viruses and bacteria. Inactive vaccinations are live viruses or bacteria that are grown in a laboratory and then inactivated with heat and/or chemicals. Inactivated vaccines are not alive and cannot replicate. Because of this, inactive vaccines cannot cause disease from infection, even in an immunodeficient person. Inactive vaccines work similar to passive immunity and always require multiple doses. The first dose does not produce protective immunity, but it does prime the immune system for future introduction of the virus or bacterium. Some inactivated vaccines may require future doses called boosters to increase protective immunity because inactivated vaccines diminish over time. As you can see, there are many key components that are considered when developing vaccines, and our immunity is the key player. In conclusion, Benjamin Jetsi was one of the first people to intentionally infect a patient with the disease, which was the beginning of the medical community starting to understand immunity in humans. As I discussed earlier, immunity is derived in two ways, active and passive. Active immunity is protection that is produced by the person's own immune system, whereas passive immunity is passed from one individual to another. Because of our better understanding of immunity, scientific research has led to the development of vaccinations. In my final topic, I discussed the two types of vaccinations, live attenuated and inactive. Live vaccines are a weakened form of viruses and bacteria, and inactive vaccinations are live viruses or bacteria that are grown in a laboratory and then inactivated with heat and/or chemicals. I hope I have given you a better understanding of what vaccinations are, how they work, and how they affect our bodies. Thank you.